Today, we go over a lot of information. There are patients that I've been seeing for a long time, brand new patients scheduling their first appointment, and patients getting their first adjustments and their first exams. We review MRIs, we get someone's three-dimensional CT scan, and we talk about brain health and spinal health from the top down. Hold nice and still. It's going to measure the heat coming off the skin on the left and right. And then what the computer is going to do for us is it's going to compare those temperatures. And what we're looking for is to see if it's the same or not. If you take a look over here, Bill, this is the temperature on the left side of your neck from bottom to top. This is the temperature on the right side of the neck from bottom to top. The line in the center is that comparison, right? You want to see no difference between the left and the right. And if that were the case, if the left and the right were the same and no difference was between them, this center line would be straight up and down like the blue line. Yours is the yellow. You see how it has these two big roundings to the right hand side? Right about, I'll show you here, right about here. And what I always like to tell people is that we don't mind the greens and yellows, but anytime you get into the oranges, we know that there's a significant amount of irritation in there. It just so happens to be on the right side where a lot of your pain is. And I always tell people too, it doesn't always correlate left to right, but when you've got fullness in the ears, ringing in the ears, things like that, it also tends to be hot on that side. It just, either way, this is an irritated spine, and so that lets us know that, yeah, there's some activity going on, and what we have to do is figure out which of these segments is turned and twisted, creating this inflammation. Because if we can fix that, you should do really, really well. Okay? So I'm going to move forward with the rest of the exam here. Okay. That's something we're going to be monitoring very closely, because at the end of the day, we want to get it to look like that one. Yeah. And we can do that, you will do very, very well. Now, part of the reason why, Bill, which complicates things, is you've had that surgery, which now I'm feeling right in here, where there's a chunk of your head missing, right? I mean, they had to go in and decompress some things. So anytime you go in and surgically move anatomy around, you're now just different. You know, those anchor points are just a little bit different. Yeah, it's changed. And that's what's going to make this so interesting, and also, to be honest with you, why you're really in the right place. Because when you've got a history of brain surgery and things like that, you really want to make sure that the person working on you has all the information. And the 3D scan we're going to do is going to give us just that. Now, in a traditional office, we would go in and manipulate that joint because it's just not functioning as well. But in our office, we ask ourselves, why is it not functioning well? You know what I mean? And it's probably that this bowling ball of a head is just not centered directly on it. Just let me know if this creates any pain. It shouldn't, but it just rules out a couple different things here. No pain, no shooting pains, anything like that.
Just the humming comes up a lot louder.
That's what you're saying, yeah, when you tilt to the left like that. How about it when you rotate?
Yeah.
So that turns up the humming as well?
Yeah.
How about to the other side?
No.
Not so much. But the right side it does?
Right there.
And that whatever is causing this twist is causing this imbalance down here, right? Now, if I did standard spinal care, I'd come in and I'd manipulate this joint. But something tells me, like most patients, you probably have the whole spine is twisted, not just this one. And the weakest part of the whole spine is right up here. So that's where I'd be curious to see if that's creating a tension down your back. Pretty simple way to check that theory. I'm just going to have you turn your face and look to your right-hand side all the way. And just relax the shoulders, relax the back, relax the legs and the feet. Right in there, just like that. And then go ahead and turn it to the other side, all the way to the left-hand side, all the way. And once you're there, just relax the shoulders, relax the back, relax the legs and the feet. Bill, when you turn to the left, if you take a look right here, when you turn to the left, your feet get just about perfectly even, right? And all you did was turn your face and look to your left. Now go ahead and look to the right-hand side. And then relax the shoulders once you get there. Just relax the shoulders, relax the back. You know, as best you can anyhow.
Yeah.
When you turn to the right, that leg jumps up almost a ½ inch. So turning one way makes it worse, turning the other way makes it better. It doesn't matter which way makes it better or which way makes it worse. When you're moving your neck and we're seeing a change in the tension down your hips, then we know two things. Your full spine is out of line and it's being controlled and influenced by your neck. So we have to figure out what's going on up at the top, get that fixed. That way the whole spine can relax, and more importantly for you, anyone with a functional disorder, fullness of the ears, nerve pain, headaches, dizziness, vertigo, concussion, things like that, is when you realign that spine, you can restore blood flow, right? And relax the nerves in and out of your skull. How have you been doing since then?
I haven't been doing very great,
Yeah,
honestly. But
that's all right.
we moved Madeline into school. I've been a lot of neck pain,
Yeah.
and I feel really stressed out. So
Yeah.
it goes hand in hand.
Yep. Is it down into the shoulders and the arms?
Yes, it is.
Right arm, left arm, or both?
Just sort of uncomfortable, and mostly my right. The CT junction's really inflamed.
Yeah,
That's how
it
it
is.
feels to me, like really inflamed.
Yeah, the top's decent. It's all this down there in the CT junction today. Just nasty there.
Been coming for about a year and a half. It was a really long road that brought me here. I started seeing a chiropractor when I was 14. I have a reverse curvature in my neck. My sister's also a chiropractor. So all the years I was treated, I was still coming up with symptoms such as fibromyalgia, autoimmune disease. I got to the point with what they consider fibromyalgia that I couldn't even flick a light switch because I was in such severe pain. And during this time, I was still seeing a chiropractor. What finally made me come to upper cervical is nothing was working correctly. Even though I was getting chiropractic care, I was still really struggling just on a day-to-day basis, sometimes to even get out of bed. I think something's getting worse. Can you finally do x-rays? And they did an x-ray that nobody else had ever done. Here it turned out that my axis and atlas sat crooked. C2 for me actually has a birth defect on it. Instead of C2 being shaped like this, with this little thing that sticks up, C2 is shaped like this. I'd had nerve issues in my hands and feet, swelling in my hands and feet. So finally, when they took these x-rays, both of them said, look at that, because they had thought it was so crooked they didn't realize C2 was damaged and sort of like off to the side. So they said, you have to see upper cervical. I called the same day, and he saw me about 3 days later. After seeing him for a few months, I started to notice a change in my hands, my feet. I was able, like I said, I was able to turn light switches on and off, which was one of the first things that I noticed, that the pain in my hands had reduced. And they had just kept, doctors, the regular medical model had just kept suggesting it was fibromyalgia, it was autoimmune, it was lack of exercise. It was doing too much, it was doing too little. And they said, no, it's none of these, it's misalignment.
You have 3 lines here, right?
Mm-hmm.
The box on the left is the temperature on the left side of your neck. The box on the right is the temperature on the right side of your neck. And the line in the center is that comparison.
Yeah.
Before we adjusted you, you were the yellow one. Right now, you're the orange. Remember, we talked about 3 areas of stress, where it goes to the right, comes to the left, goes to the right again.
Yeah.
And we talked about we want 2 things. We want change in the beginning, calmness over time. These peaks out to the right are no longer going to be in that zone of the oranges. Remember, we want to get out of the oranges and reds, into the greens and yellows. This is you now. So that's really quite good. It's really, really good.
Good.
And when you have a reduction like this, if we step over here for just a second, I'll show you something here. So just got off the phone with an educator who's got an adult student who's having chronic neck and shoulder pains. She's gone to different therapists, doctors, and chiropractors. Nothing seems to help it stick. Issue is, if someone's been through those therapies and it's still a problem, then we have to start changing the way we look at the problem from the top down. And what a lot of people don't realize is you've got this bowling ball for a head that sits on this pedestal of the spine. And for every half of an inch the bowling ball shifts, the research says it adds about 10 pounds of responsibility to the neck and shoulders. Where we feel soreness is generally right in the shoulders. One other thing I'll show you, just to kind of illustrate the point, imagine that my fist is my head, right? You've got muscles down in here, my forearm, which are like the muscles of my shoulders. So as my head rolls around this pivot point of my wrist, you can see the tendons, right? You can see the tendons in here are kind of moving. So even though my fist is moving, it's these muscles down here that are doing all the work. So as my head is moving around, if it's unstable, the muscles that are doing the work, the heavy lifting, are the muscles in the lower neck and the shoulders. The problem is not down here. The problem is the weight of the head that needs to be rebalanced so these muscles can actually permanently just relax. So some good information, especially if you know someone's dealing with that kind of stuff.
I had a headache for a year, could not get rid of it. I'll be honest with you, I was scared to death coming here. This is a new concept for a lot of people. I've had so much trouble with my back and so many surgeries. Very apprehensive. And I sat down, talked with him for a few minutes, and I went, what have I got to lose? A little bit of money and a little bit of time, and it might work. And he finally got rid of the headache I'd had for a year.
So today I'm working on actually invitations for our dinner coming up in the next few months here. I am working on putting all our addresses on all our brochures on the back so people know where we're from. Busy day, but I like it because it makes the day go quick.
That's the opening where the spinal cord goes through, and you'll see these structures inside of it. This circle right here is the spinal cord itself. These two structures are the cerebellar tonsils. It's part of the brain. It's like little kidney beans dropping into that kitchen sink that can create some pressure there. They don't really belong there. These white circles are the vertebral arteries. They're bringing oxygen up into the brain, just like these vessels are as well. But here's what happens. If we go a little higher, we'll look at these blood vessels here, and the next level up, what you'll see is one of the blood vessels cut across like this. It gets a little bit friendly with the brain there, it gets a little close. This blood vessel here is kind of tucked inside the brain. Question is, does that create any pressure? Does it create any irritation, any disturbance? We don't know, but these are things that we look for because a lot of these symptoms, there's no other solution to them. Could it be that the top bone in the neck is turning and twisting, and as a result, could it be putting pressure on those arteries and making them rub up against the base of the brain, which is what we're seeing right here in this MRI? It's very possible. All we can do is say, hey, let's start working on this person. We want to review these for people. That's a big part of what we do here at the clinic, is we review people's medical imaging to try and make sense of their situation.
I'm Teresa. I have been coming to upper cervical for about 6 weeks now. Prior to coming to upper cervical and finding Dr. Bulow, I had migraines. I've had them my whole life, and my neurologist put me on medication, and I was hoping to find somebody that would maybe help me, first of all, to not have as many migraines. I get about 2 to 3 a week, and the medications are not helping. So a friend of mine actually came to Dr. Bulow, and he helped with her migraines, so I was hoping that he could help me with mine. After the first 4 weeks, I saw a noticeable improvement in the migraines. As I said, I was getting 2 to 3 a week, and in the last week and a half, I haven't had any migraines. And every week, you expect a migraine when you get them. I can now plan things and not expect a migraine to pop up and have me cancel things. And we're going to continue treatment because it hasn't been that long, and I'm really hoping that, I can maybe back down on the medication. It's amazing. You have to have migraines to understand how much this can change your life.
So how did you do that day? How did you do that weekend? What was the kind of...
Well, halfway home to Erie, I just noticed the pressure in my ear was gone and the tinnitus was gone. I had relief for probably maybe like 20 hours, and I could see it coming back, but I know it's just not the muscle memory yet.
Leading up until Friday, how long it had been going on?
Since like April.
Since April.
Yeah.
And we're in the beginning of September. And it was, did you ever have a break between April and September?
No, it was nonstop.
Not bad, we'll take it.
Yeah.
I'm excited to hear what you think about it. Please let me know in the comments section with the video. Share it. You never know whose life you could change by sharing this great information. And we'll talk to you guys real soon.